Hi, my name is Jill Kregel, and I am head of partnerships across all of our healthcare clients here at Omnicom Media Health. My role is unique in that I provide thought leadership and investment strategy across all of our healthcare clients.
Jill, as we get started talking about orchestration and omnichannel, would love to know from your perspective, what does true omnichannel orchestration mean beyond just multi-channel?
It's a great question because in the past, especially with pharma, omnichannel has really just simply meant, being across all channels. But true orchestration is so much more than that. It's about coordinating those channels around shared signals so that every interaction builds on the next one.
Right.
So instead of optimizing every channel independently, we're sequencing the messaging so we can be where patients and where HCPs actually are engaging. And in practice, this means, connecting signals across environments and adapting different experiences in real time to make the patient journey more cohesive. Because, at the end of the day, being everywhere isn't the goal, it's being connected.
What role does real-time data play in this orchestration strategy?
hmm What's changing is that we can now use those signals to inform our sequencing across channels. And this allows teams to optimize and prioritize based on actual engagements. So real-time data turns omnichannel from a reporting exercise into a dynamic decision engine.
Jill, who do you think should ultimately own the orchestration strategy? Is it the agency, brand, platform? What's your perspective on that?
So I think the orchestration ultimately is a collaboration between all three, between brands, agencies, and platforms, because no single entity would own that because, platforms have data, brands have strategy, and agencies have that cross-ecosystem visibility. True orchestration sits at that strategy layer above the platform where brands and agencies can see the full ecosystem. And while platforms play this critical role as activation engines, orchestration requires a neutral vantage point to coordinate across all of them to create more of a cohesive experience. And because the healthcare journey is not always linear, that's why orchestration matters more than ever.